Therapists of Reddit, have you ever been genuinely scared of a patient, and why? I'm a woman and a therapist who works with people facing some of the most severe psychological challenges. Years ago, I had a new client come in for an initial session. His file was frankly terrifying, full of red flags that might suggest a future serial killer. Childhood animal abuse, violent behavior toward other children, even early homicidal attempts. When I first read his history, I had a visceral, instinctive reaction. Something like, oh no, what am I getting into? But very quickly, that shifted to a more grounded and compassionate place. What happened to this person? As we began working together, I came to understand just how horrifying his own childhood had been. What he endured was beyond what most people can imagine. Through our therapy work, he made significant progress. The last I heard, he was doing quite well in life. This experience reinforced one of the core values I hold as a therapist. I don't give up on people just because they've done terrible things or are capable of darkness. People are not just their actions. They're their histories, their pain, and their potential for healing. No, I do not accept private clients, and I cannot ethically offer therapy or advice to individuals over the internet. Please do not send me direct messages asking for help or sharing personal details. If you're seeking therapy, I recommend looking into psychoanalytic clinics. Many offer sliding scale fees and now provide telehealth services. Therapists are licensed by state, so even if you don't live close to an office, you might still be eligible to work with someone within your state via video sessions. Please avoid platforms like BetterHelp. While they charge clients a premium, they often underpay therapists to unsustainable levels. This leads to high turnover and burned out clinicians, bad for the therapists, and worse for the people trying to get help. These platforms benefit primarily the corporations skimming off the top. And finally, for those who took issue with me stating that I am a woman, ask yourself why that bothers you. The discomfort is yours to examine, not mine to answer for. When I was 18, I checked into my university's psychiatric hospital due to suicidal ideation. I was placed in the under 22 group. Most of us were young, struggling, and just trying to stay afloat. Among us was a man in his 20s, a firefighter. I heard through the usual grapevine of overly curious patients. Apparently, he was bipolar. No big deal. Everyone in there had something going on. That's why we were there. He was quiet. Like very quiet. Decently attractive, but what stood out most was the way he would stare, this unblinking, fixed gaze. All day long. Always at me. I'm a shy person by nature. I don't think I'd said more than 2 words to him the entire time. Maybe a quick smile in passing if I accidentally made eye contact, which I avoided because, well, the staring was intense. In the common room, a sort of living room space for patients, we'd all hang out, kill time, and wait for our release dates. He'd sit across from me every day with a sketchbook. I figured it was just something to pass the time. When you're committed, you can't leave until a doctor clears you, so hobbies are everything. Then my mom came to visit. She noticed the guy staring too. At first, she didn't say anything, but as she walked behind him while he was sketching, she suddenly froze. Completely. Like someone hit pause on her body. Just stopped mid-step. What she saw in that sketchbook shook her, a highly detailed drawing of me, hanging from the ceiling of the psych ward. She calmly alerted the nurses. Security got involved, and the guy was removed from the room. I never saw him again. A couple days later, I overheard some nurses talking. Apparently, his entire sketchbook was filled with drawings of me, dead, in various scenarios. Every single page. To this day, It remains the most terrifying experience I've ever had. There's only been one person who's truly made me feel afraid, someone who once threatened to kill me. I could tell she wasn't bluffing. She had already assaulted several staff members by then. Eventually, she was transferred to a higher security ward, and I later heard she broke a staff member's fingers on her first day there. Before she was moved, there was an incident where she took over one of our rooms, holding both staff and patients hostage. She circled the table slowly, almost as if toying with them, creating an atmosphere thick with tension. I've seen my fair share of violence and aggression in this job, enough that it usually doesn't rattle me. But she was different. I found myself deliberately avoiding eye contact, staring straight ahead and pretending not to be intimidated, even though I was. I knew that's what she wanted, to see fear. And I wasn't going to give her that satisfaction. I have this one patient who calls us every month or two, saying he's overdosed on meds. He even wears gear with our logo and pretends to be part of our ambulance service. At one point, he showed up at real emergency scenes, acting like one of our first responders. It took one of our deputies putting him in handcuffs before he finally stopped doing that. He also carries a radio and a pager, though the radio only receives, and he sometimes records our conversations and sends them to me. Strangely, he's actually a very kind person. If you talk to him without mentioning the ambulance, you'd never guess he has these issues. He doesn't scare me, but some of our more experienced crew members are definitely uneasy around him, so maybe they see something I don't. When I was in medical school, our psychiatry attending shared a story from years earlier. She had dyed her hair red, and just a few weeks later, she was assigned a patient who was obsessed with redheaded women. The patient was fixated on the idea of killing redheads and putting their plucked heads into boxes. Because of the risk, she took 2 weeks off, and another doctor cared for the patient during that time. I once worked with a patient who was tormented by recurring night terrors. His dreams were always the same: lobsters being boiled alive. He was genuinely perplexed, unable to connect these vivid nightmares to any cause. What he couldn't seem to grasp was the horrifyingly obvious reason. He had murdered his girlfriend, dismembered her, and boiled her head. The disconnect was chilling. My greatest fear is the day the system might have to release him, as it seemed impossible to ever restore him to a state of sanity fit for trial. Yes, the situation was intense enough that I ended up quitting my job. I was managing a high caseload of suicidal teens. Most were medicated and considered low risk, but there were 2 kids who had multiple suicide attempts both before and during my care. The stress was overwhelming. I was physically ill, barely sleeping, and constantly worried. I pushed to have them transferred to a higher level of care, but the company resisted, unwilling to lose the funding those cases brought in. In the end, I quit on the spot so those kids could receive trauma-focused therapy and the help they truly needed. It was the best decision for both myself and those children. I'm not a therapist, just a school counselor, a small, young woman. One of my students is 6 feet 4 inches and struggles with emotional and behavioral issues. Reading his social history broke my heart. He's been through so much trauma. Naturally, I have a soft spot for him. But his anger can spiral out of control, and it's genuinely frightening. One time, he punched a pole right in front of me, missing my face by inches. I locked eyes with him and firmly asked, "Do you realize you almost just punched me in the face?" That snapped him out of his rage, and he apologized over and over. I wanted to wrap him in a hug and tell him everything would be okay. My uncle is a therapist, and yes, they do see people with really tough issues, but it's not like the movies make it out to be. Most of his clients come to him with everyday problems that many people can relate to. People seek therapy for all kinds of reasons. So when someone comes to him with violent thoughts or deeply disturbing beliefs, it's just as shocking to him as it would be to anyone else. The difference is that therapists are trained to manage those situations more effectively. But underneath it all, their emotional reactions are much the same as anyone else's. As a former therapist at a behavioral health hospital, I encountered patients who, in theory, genuinely scared me, but nothing ever materialized from those fears. The two significant attacks I experienced at work, however, came from unexpected sources. Both were young women. Neither had scared me beforehand. In fact, both were incredibly quiet, withdrawn, and unassuming. One patient tried to strangle me with my keys. My lanyard was designed with a breakaway feature for this very reason, but earlier in the shift, she'd repeatedly tried to steal my keys to escape the building and run into traffic. Foolishly, I nodded off the breakaway portion. Thankfully, we carried panic buttons on our lanyards, and I managed to press mine while being strangled. The other attack happened when I was relatively new, working on a low-security unit with other staff nearby. I was walking away from a patient when she suddenly grabbed me by my hair, pulled me to the ground, and dragged me several feet down the hallway. She then began kicking me in the chest and stomach. As a result, she was transferred to a higher security unit. I guess I was afraid of her after that, but she wasn't there long. Law enforcement eventually intervened after she assaulted a pregnant nurse, pulling her to the ground and stomping on her stomach. During my first semester as a practicum therapist, a client once brought a large hunting knife to our session. He had it tucked into the back of his waistband. He revealed it halfway through the meeting. He had been referred to our practice for anger issues. Another client, a huge man, confessed to punching a sleeping infant repeatedly in the face and head out of jealousy. Then, one day he came to session seeming calmer than usual. As we talked about the previous week's session, he told me how much he hated his wife and mentioned that he had recently bought a gun for deer hunting, despite living in Southern California. That was our last session. He never came back. I still think about him and hope that baby is okay. When in doubt, report. Yes, I've had a few scary moments, but there was only one time I truly felt in real danger. Apologies for the long story. Before I became a therapist, I worked briefly at a residential facility for youth with severe neurodevelopmental disabilities, things like autism and intellectual disability, who also had behavioral challenges. Nearly all of these kids had histories of violence and trauma, and about 2/3 were in state custody. The place was a for-profit institution, poorly managed and severely understaffed. I was working on the older boys' wing, trying to get my group ready to transition to the next activity. One boy in my group, let's call him Jay, was relatively high-functioning but had serious attachment issues. When new staff arrived, he would quickly latch onto a favorite, usually someone who treated the residents with genuine respect. Jay was funny, likable, and generally cooperative, with a bit of sass that just added to his mischievous charm. But over time, he'd start pushing boundaries, insisting he be in that staff members group, despite groups rotating every shift, constantly demanding attention and acting out to provoke reactions. One time, he told me I'd never get a boyfriend because I had a mustache. If he didn't get his way, he'd become very angry and upset. Yet, when you saw him next, he'd be sweet as pie. It was a confusing pattern. Oh, and he had once stabbed a previous favorite staff member in the face with a pencil. On this particular day, as I was trying to get my group ready, Jay had been calling my name repeatedly for about 5 minutes. To avoid reinforcing his tantrum, I told him I'd be happy to talk once we were ready to go, then started ignoring him. I went into a residence room, someone with more significant needs, largely nonverbal and intellectually disabled, to help put on his shoes. I closed the door to shield him from Jay's yelling. Suddenly, Jay launched himself at the door, furious, trying to get inside. I didn't know what he planned, but it was definitely not a calm conversation. I braced myself, pushing my full weight against the door to keep it closed. Jay was 15 and much bigger than me. Not hard, as I'm only 5 feet 0 inches. The doors didn't have locks, and he managed to force it open just a crack. I could see a smile on his face, as if this was a game, but his rage was still very real and threatening. I was panicking, yelling for backup, but I couldn't reach my walkie-talkie without letting go of the door. Out of nowhere, Jay was tackled to the ground with a heavy thud. I slammed the door shut and sent out an emergency call on my walkie. When I came out shaking, Jay was being restrained by staff, his lip bleeding. To my surprise, another resident, Tom, was being held calmly nearby. Apparently, Tom had witnessed domestic violence in his past, and seeing someone try to hurt a woman triggered him deeply. So he had sprinted out, tackled Jay, and held him down. Tom's parents had enrolled him in karate instead of therapy, so he knew exactly what he was doing. Tom had to face the usual consequences, physical restraint until no longer a threat and loss of privileges for the day, but I made sure to thank him. I honestly don't know what would have happened if he hadn't stepped in. I worked in residential care for 20 years, and only 2 kids ever truly scared me. One of them put his baby sister in the freezer. Thankfully, she was found quickly and was okay. He was charming, good-looking, and very clever, with no history of trauma or abuse. He gave off serious serial killer vibes. The other had suffered horrific abuse and somehow figured out I was pregnant, even though I wasn't showing at all because of my body size. He would just stare at my stomach, which made me uncomfortable enough to ask to be moved to a different group. The first kid has, or maybe still is, a case study at the local university. Genuinely scared for myself? Not really. I work on an inpatient unit, so there are always people around. We've had violent patients and stressful incidents, but I've never thought, wow, this person is truly dangerous. It's easier to feel safe when you trust your coworkers. That said, I have definitely felt scared for my patients. Despite our best efforts, some will still kill themselves. Usually, these are patients struggling with addiction. Addiction is fatal 100% of the time if the person keeps using, whether from overdose or long-term complications. There are also depressed patients who likely remain suicidal but adamantly deny it. We can only keep someone in care for so long, and you can't effectively treat someone who refuses treatment. They might tell you they're okay, leave your office, and do the opposite. Bipolar patients can be particularly challenging because many love their manic highs and can't stand feeling normal. Who wants to feel normal when you can feel amazing? Of course, mania comes with many dangers and consequences. Psychotic patients aren't usually scary. People fear the idea of psychosis, but it's important to remember that it's their reality in the moment. Violence from psychotic patients is very rare. Most of the violent psychotic patients I've seen tend to be inwardly violent, willing to hurt themselves even if they feel threatened externally. Addicts are generally the ones you worry about flipping out. It's usually due to withdrawal and their desire to leave and get high. Sometimes they act out to get medicated or become threatening. But honestly, that doesn't really scare me. There have been patients who disturb me, but that's a different story. I'm not a therapist, but I used to be friends with someone who had borderline personality disorder and Munchausen syndrome. She struggled to keep a therapist for very long. It wasn't until later in our friendship that I fully realized just how severe her mental illness was. She lied constantly. Her main goal, even with her therapists, seemed to be to cast herself as the hero. When therapists told her they couldn't help and that she needed someone who specialized in BPD, which she often denied having, she would become absolutely furious. I genuinely worried for her therapists and anyone else around her. At one point, I even informed her therapist about some things she had said to see if I should report it to the police. That woman was truly, deeply frightening. I remember one instance on an adult acute unit. There was this guy who ended up there under bizarre circumstances. He was a pretty important and charismatic figure in his rural community. His huge family even drove several hours to attend his family session. Our unit had translucent, floor-to-ceiling windows, letting light in but preventing anyone from seeing in or out for privacy. I met with patients individually and in groups. My office door locked automatically, as is typical for acute units, and only I and the custodian had a key. Because of this, I usually met with patients individually in the empty group room. It offered privacy, but also ensured I could get help if needed. This guy came to my office door and knocked. When I opened it, he walked in without an invitation and sat in one of the two chairs on the door side of my desk. I sat in the other. He started going on about how much he appreciated my work and how much I'd helped him. It felt disingenuous. He often indicated he didn't even feel he needed to be there. I gradually became aware that he was between me and the door. This usually isn't a problem. In fact, you want patients to have easy access to an exit. Contrary to popular belief, you generally don't want to be between a patient and the door. When I later did home-based work, being closest to the door was definitely the rule. I also became uncomfortably aware of how close he was to me. He could easily touch me if he chose to. Alarm bells started ringing because I don't usually feel uncomfortable with proximity as long as I generally feel safe. Then, out of nowhere, he suddenly asked, "How do you like driving that little silver make and model of my exact car?" Every hair on my body stood on end. The building's windows were frosted, so there was no way he could have seen me getting into or out of my car. I had a sudden mental image of being in a room with a tiger. Maybe I'd be fine. Maybe the tiger wasn't hungry or angry. Or maybe he was. I realized I was only going to get out of that room safely if he decided to let me. That's exactly the experience he wanted me to have, and I could see he was enjoying it. That was truly scary, even though I had no reason to believe he intended to physically harm me. Thank goodness I have a degree in theater. I'm sure his predatory instincts told him I'd received his message loud and clear, but I gave no outward indication of my feelings. I got him out by saying I had to meet with the psychiatrist, and he left the unit soon after. That was very early in my career, one of the first of a handful of such instances. I've done meaningful work with murderers, rapists, animal and child abusers, and just ordinary bullies. Like I said, it's not about what someone has done. The folks who've genuinely frightened me, with one notable exception, were just ordinary people without scary rap sheets. I was a therapist when I took on a new patient, a young man who had witnessed his mother being stabbed by his father. After that horrific event, his communication shifted dramatically. He'd only talk about gore and began threatening people. I worked with him for about a month, and he started making significant progress. I began to feel more at ease around him. It seemed he felt the same comfort with me. Then one day, he walked in my office. He approached me, and from behind his back, he suddenly produced a knife. I barely had time to dodge the blade. Immediately, a guard rushed into the office and apprehended the boy. He was sent to juvie, and I resigned from my position a week later. I'm not a therapist yet, still working on it, but I'm a bachelor-level social worker doing intake support at a psychiatric hospital. Close enough? There was one patient who genuinely scared me because I feared for my personal safety. She came in experiencing auditory and visual hallucinations, but was still oriented times 4, basically with it, just agitated. I often work with psychotic patients, and while there's usually some unpredictability, that alone doesn't scare me. I just stay alert, and things usually stay under control. But this patient got increasingly agitated as she waded through the admission process. For some reason, she zeroed in on me. Her complaints turned into yelling at me, then threatening me, and finally she got right up in my face. The look in her eyes was unlike anything I'd seen before. She absolutely wanted to hurt me. I firmly told her to sit back down, and thankfully she backed off after her family intervened and calmed her down a bit. Afterwards, I left the room and sat with a coworker at the front desk, saying, "Dude, I think I'm just gonna chill here until she gets settled on the unit." He agreed, and honestly, that was the first and only time I genuinely felt afraid of patient at work. We see many high acuity patients, psychosis, hallucinations, stimulant intoxication, even some with homicidal ideation. One strangled a family cat. None of those patients have truly scared me. I see them as very ill people in need of help. Usually, they're not even fully aware of what they're doing or saying, and I don't take their outbursts personally. But that one woman, it felt like she genuinely meant to do me harm. My therapist suddenly stopped responding after canceling my last 3 sessions at the last minute. She no longer answered her work email or phone. I'm pretty sure I must have upset her somehow. Honestly, it's been really hard knowing that after almost 10 years of building up the courage to seek help, my therapist just gave up on me without any explanation. During one of my first clinical placements, I was supervised by a psychiatrist who would assign me cases without much guidance or review. One afternoon, I met a patient for the first time who was described simply as anxious. However, the individual was actually floridly psychotic. Shortly after I entered the room, he told me he was scared for himself and others because he believed he was a werewolf and would be transforming that evening. Apparently, my response wasn't quick or meaningful enough for him. Almost immediately, he accused me of not taking him seriously, grabbed the office lamp, and threatened to beat me to death with it. The only client who truly scared me was the one who was nice to me. He was terrible to everyone else on the treatment team and refused to cooperate with services until I came along. He always greeted me with a smile, asked personal questions, and wanted to know about my life. I ended up lying about everything just to keep boundaries. Sometimes he would call me to chat about nothing in particular. I knew it was all superficial, but it still unnerved me. I had to text my supervisor when I arrived at his home, and again when I was safely back in my car with the doors locked. When I found out I was pregnant, I begged to be removed from the case. I'm obviously not a therapist, and this is a bit off topic, but I've always wanted to share this story. I went to the ER because I was having suicidal thoughts. Someone there lied to me and told me there was a courtyard in the psych ward, K1, where I could do my sessions. The reason I didn't want to go back there was that I needed fresh air. It was the only thing that made me feel anything at that point in my life. When I got there and asked about the courtyard, the nurses all looked at me like I was crazy. There was no courtyard. That staff member was so worried I might harm myself that she lied to get me admitted to the psych ward. At the time, I was upset, but looking back, she probably saved my life. I wasn't fully committed to ending things, but with all the drugs and alcohol I was using, I was one bad decision away from it. During group therapy on K1, there was a guy who freaked out one day and threw his binder at the wall just above the therapist's head. The rest of us jumped up to calm him down, but he ended up leaving early and apologized the next day. Sadly, he's no longer with us. He took his own life. He was a very troubled person. I'll never forget the look of fear on the therapist's face that day. In my first job as a therapist in community mental health, there was no close time, and we were expected to accommodate any and all late session requests from clients with no security. It was absolutely chaotic. One incident involved a co-worker whose client exposed himself during a session. At the next staff meeting, instead of support, we were berated and gaslit about safety, told things like you should park closer. But then we'd get in trouble for parking closer because those spots were supposedly reserved for clients. Needless to say, I only lasted about 7 months there. The daily crying and intense anxiety were just too much for me. I'm a therapist with 14 years of experience. Twice, clients have threatened to murder me, but I never truly believed they would follow through. I also had a client who had killed someone and hadn't been caught, but he was very kind to me. Honestly, I've never been genuinely scared by a client. Being a male therapist probably makes a difference, especially since about 80% of therapists are female. My good friend came to visit me about a year ago. He'd moved out of state a few years prior, and we kept in touch semi-regularly. The night he arrived, our mutual friend called me, explaining that he'd been secretly using meth for a year. He was aggressive, convinced our other friend was a pedophile, and had run off. They couldn't find him and needed help. Then his foster mother called, saying he'd been arrested and asked if I could bail him out. I told her I'd rather pick him up in the morning when he was a bit more sober. The next morning, I called the police station. They informed me they'd released him high at 4 a.m. I drove around, constantly calling his phone, searching for him. I finally found him at a gas station. I barely recognized him. He was incredibly thin and wearing a sombrero he'd apparently found on the side of the road. I got out of my car and approached him. "Hey man, I've been looking for you. Want to come to my place for breakfast?" I asked. He looked at me with dead eyes and said, "Sydney, you've seen death. I can smell it on you. There are rapists here. I'm scared. I want to go. I'm a rapist. I'm going to rape you. I am scared. Let's go." I was horrified. He used to be the most bubbly person I'd ever met before he started using. Despite my fear, I took him back to my place. I let him play with my cats and made him pancakes, then excused myself to the bathroom. From there, I called 911 and had him placed on a 5,150 hold. I did my absolute best to get him into rehab and help him in any way I could. He ended up moving to Florida to live with his abusive father, who had abandoned him on a highway median as an infant. He died by suicide a month ago. I'm incredibly sad that our last encounter was like that. As a school counselor, some kids set off every red flag and make the hair on the back of my neck stand up. I care for them deeply and am committed to supporting them no matter what, but it's hard not to feel a fear about what they might become or what they might do down the road. Not a therapist, but I've been on the other side. I spent years going in and out of psych wards, and honestly, I was never really scared of anyone until I met this one girl. I can't quite explain why she scared me. It was more of a dark, unsettling feeling whenever I was around her, like my intuition was warning me something was seriously off. There wasn't any clear reason to think she was dangerous, but that gut feeling stayed with me. Even years later, I still get a strange chill when I think about her, and I still don't know why. On my first day as a therapist in an inpatient behavioral health unit, an adult woman grabbed a large microwave and hurled it at someone. She was then assigned to me, and within the first 5 minutes of trying to get to know her, I asked the wrong questions. She later complained to staff about that therapist who keeps asking me how my day is. I broke down in the bathroom, nearly quitting, convinced every day would be that difficult. But with support and coaching from her preferred staff, she eventually softened, became genuinely kind, and even started chatting with me about the names of her stuffed animals. Over time, my instincts have sharpened. I've learned how much to push, when to engage deeply, and when to meet patients in private offices versus their rooms. Sometimes I let new patients rest and stabilize on medication before diving into deeper conversations. This is the best job I've ever had. I look forward to work every day. Most of my patients are truly sweet, though I've preemptively blocked a few on social media before their discharge because my full name appears on their paperwork, and I worry they might try to look me up or message me. Oh, I've got one to share. I had just graduated and was working with kids who had various developmental disabilities. There was this one kid, about 13 years old, pretty big for his age. At first, after a few sessions, things seemed manageable. His behaviors, though frequent, were typical for kids with similar diagnoses. That all changed the day I showed up wearing a knee brace. My knee gives me trouble, and the brace helps. At the next session, he kicked my injured knee and even tried to choke me. Whenever he got aggressive or tried to escape, he always targeted my knee. We kept going for a few months, but I eventually had to stop for health reasons. Apparently, I handled those situations well because the company kept assigning me to work with known aggressive kids. Once, when I went to the doctor for an unrelated issue, the nurse asked if my husband had been abusing me because of all the cuts and bruises I had. I don't do therapy anymore. Back when I worked with family court, there was this incredibly smart but deeply troubled kid. He got into serious trouble for beating a random man on the street with a baseball bat. The case was clear-cut. The surveillance cameras caught everything. Apparently, he didn't even know the guy. It was just a random, violent act. The kid was being tried as an adult because he really did a number on that man and was held in an adult jail before the trial. He was assigned a therapist and had a few sessions each week. One day, during a session, the kid suddenly flew into a rage. He grabbed the chair he was sitting on and brutally attacked his therapist, leaving him fighting for his life. The therapist ended up on a ventilator for about a week. Yeah, that kid definitely had some serious issues. I once worked with a student who frequently threatened staff. He would stand directly behind me, a pencil in hand, and threaten to stab me with it. I'd calmly remind him of the consequences, but I never flinched or turned to look at him. This would enrage him, and he'd hurl the pencil across the room. It turned out that only I and one other female colleague were able to maintain a poker face during these episodes. He'd escalate significantly if he sensed fear. I was the lucky one. He'd only threaten to stab me. My colleague, however, endured threats of being stabbed directly in the eye. I used to grimly joke that I'd rather not see it coming. If you made it to the end of the video, thanks for watching. Don't forget to like, subscribe, and share, and we will see you in the next video.